Well, it's certainly the most popular New Year's resolution, we know this, every year is to lose weight or get fit. Well, Dr. Jennifer Stagg is here helping us understand the problems behind weight gain and what we can do to fix it. We're having an interesting conversation before break. You're a naturopathic physician.
Right.
So it means you look at the whole body, right?
Exactly. Yeah, so when a patient comes to my office, I'm looking at an individualized approach. As for weight loss specifically, I would be trying to understand why they're having a problem losing weight.
And the why is something we don't pay a lot of attention to. Most people just think, oh, close your mouth, you're being lazy. And you found by looking at people, there can be really things going on that are preventing them from losing weight.
Absolutely. So certainly the standard American diet, yes, that's a problem. That's a big issue for people. But sometimes there's genetic predisposition, so problems that can be determined through lab work even. And we even look for medical problems, why someone could be having a problem with losing weight.
So those are 3 reasons right there. And this is not to mean that it's an excuse, but if someone comes to you, what will you do to help them actually begin to really lose weight?
Right. So first, I'm doing a thorough physical exam, history, and then also often sending them for lab work to determine what could be going on metabolically.
Okay. And so you've got some things you want to talk about. What is that?
So in our office, we use a number of different approaches for weight loss. And so one that we've been using for people who really need to lose a decent amount of weight is this new program called Healthy Transformation. And so it is a medical weight loss program, and it emphasizes stimulating your body to burn fat while maintaining your muscle mass. And so a lot of the weight loss programs out there don't do that.
Okay, and because you're a naturopathic physician, I know you would be very concerned about ingredients and that things are good for the body. So these are not harsh chemicals or unsafe things.
Right, and so a lot of times when people are dieting, they may not be looking at their long-term nutritional needs. And so with this program, we're emphasizing making sure you're getting enough protein. And so we have in the program, it's simple for one thing. It's a pre-packaged kit, so you have protein options with shakes and bars, soup option even, while also supporting generalized nutrition needs through supplements.
So if someone were to come to you, what would be some of the reasons you might discover that, say, a woman in her 30s or 40s, she's just not losing the weight?
Right, exactly. So a lot of times what we're seeing is stress, for one thing. So. Wow. As a result of stress, you can have elevated cortisol levels, and that will cause you to store fat in your body. Not a good thing, obviously. And so then we're working on also not just what you're eating and the pattern of your eating, but also trying to address how we can better manage stress.
And once you do this, have you found that people are getting great results and finally losing weight?
Yes, absolutely. So it makes a huge difference for people to really look at a holistic approach to their weight problems.
You talked about the American diet, but everyone out there, we're all eating, and it seems like overwhelming with all the information out there. What are the most common eating styles associated with being overweight?
Right, so emotional eating is probably the biggest issue for people. So when people are eating because they're upset or angry, then that's going to cause a problem. Also, when people are eating in a rush, and so like eating at your desk because you're really busy, I'm definitely guilty of this.
Every day I do this. That makes you gain weight?
It can.
Is that because you're not paying, as you say?
Exactly. So you're not paying attention to it. Yeah, and so eating alone also, and then this food fretting and feeling guilty about overeating, that has been associated with obesity as well.
So just the emotional part of our body can actually mess with our hormones, and then we're storing fat.
Absolutely.
Okay.
Yes.
So if you think you're overweight, what's the best body composition test to find out and to really get a hold of your problem?
Right. So we look at body mass index. That can be a measure. That's how we determine whether someone is obese or overweight. So categorize them there. However, there are even better tests. So looking at waist circumference. So for a woman, a waist circumference over 35 inches is definitely associated with health problems. And for men, it's over 40 inches. But there are also standardized tests that you can do in our office. We use a bioelectrical impedance analysis, which gives us an exact printout of your fat mass, your muscle, water mass, and we can track patients over time.
Okay, so if someone wants to come to you, you're located right in Avon, right?
Yes.
And it begins, what you're going to do is, you're using a scientific yet natural approach.
Yes, exactly.
And you'll have all the support you need. How long does it take, or how much weight can you expect to be taking off with your program?
Right, so with this program specifically, this has been clinically studied in 12 weeks, and the average weight loss was 11% for most patients.
11%?
Yeah, and some of the patients
on
body weight. Yeah, exactly. And some of the patients lost even more weight than that in 12 weeks.
Okay. Well, we're going to have all the information. Dr. Jennifer Stagg, a well-recognized naturopathic physician right here in Avon. So if you're looking for some structure, but you also want a natural approach, people can come see you in Avon.
Yeah.
All right, thank you so much, Scott.
Very, very